it's going to have strong implications because, as we've kind of seen here, is employers are now going to be taxed for having too rich of a plan, and as we'll see in a second, they're also going to be taxed for having too poor of a plan, which leads us to pay or play. There's a lot of arguments out there about whether or not employers are going to continue coverage, because if you're an employer with over 50 full-time employees, you're considered to be a large employer, and by that it means that you must provide affordable health coverage to your employees, or you're going to have to pay a fine of $2,000 a year per employee. And there's certain rules that go into this. For instance, a full-time employee is one that works 30 hours a week or more. Affordable care means that the employee's portion of those premiums can't exceed 9.5% of the total household income, and employers must pay at least 60% of the fees. So there's a lot of restrictions here. Again, they're taxed or pay fines or penalties if it's too rich of a plan, and again, if it's too poor of a plan. There's a lot of restrictions here. Now, what happens if the employer offers health coverage and the employee declines it and instead goes into their state's health exchanges and receives their coverage there? Well, in that case, the employer is now going to have to spend $250 a month, or $2,800 a year per employee that does that. So again, we're seeing that theme. They're pretty much going to pay fines or penalties either way, which are really going to have these strong implications. Employers are either going to reduce the coverage or just terminate the policies altogether. And AT&T looked into this, into the math, and they found that they spend about $2.4 billion a year insuring their 300,000 employees. If they were to cancel coverage outright, it would cost them around $600 million a year. So basically, if they were to cancel coverage, pay all the fines and penalties, AT&T would save $1.8 billion a year. Now, I'm obviously not the CEO of AT&T, but I could imagine, unfortunately, that a decision like that wouldn't be that hard to make, saving $1.8 billion a year, especially in these economic times. Likewise, Verizon looked at the Cadillac tax and estimated it's going to cost them an extra $255 million a year, just on that one provision alone. As you can see on the screens, some companies are saying they might cancel it. Some are saying they won't. But, I'm not sure what's going to happen. I mean, after all, the whole reason why that you have employer-sponsored health insurance is because it was used as a recruitment vehicle. And as you can see on the screen, I mean, 87% of employers think they're going to still offer it for that same very reason. So what does all this mean? Well, it means that there are no clear answers. We don't really know what's going to happen. The only thing that we know is that we're in for a long, ongoing debate that's going to get completely heated next year as we enter the 2012 election cycle, and this could continue possibly throughout the next decade. Now, next month on March 1st, we're going to cover part 2 of this, which will deal solely with insurance companies, Medicare, and then some of the wellness provisions that's in the bill. And I please hope that you will please join us on March 1st for that webinar. What I'd like to do right now is open us up to a few questions, and I'm just going to take a quick second to look at what some of your questions are here. Okay. Looks like we're getting a lot of questions on the ruling yesterday from the federal judge. And I'm just going to try to answer all these at once here, and I hope that I can. So again, what that judge ruled is that the individual mandate per the Constitution is unconstitutional. And in fact, I believe his words were that Congress cannot force inactivity through interstate commerce, meaning that they can't control an individual to make a purchase to buy a good or service, and likewise they can't tax a person for inactivity. They can't tax you for not buying it. And in fact, his interpretation, actually, the analogy that he used went back to the old back in the 1700s with the Tea Party and all that, where you were actually taxed with the Stamp Act, and you're taxed for having tea and all that kind of stuff. And that's what led to the Revolutionary War. People saying, "Hey, you can't be taxed for buying or not buying something," and that's what his interpretation of this healthcare reform bill is. Now, other federal judges have ruled the opposite way, saying that they thought that it is constitutional and that the government can force you to buy health insurance or be taxed if you don't, with a penalty. But nobody's actually taken as far as yesterday's judge did in terms of saying that the entire bill is unconstitutional and therefore invalid. And that has to do with the severability clause. In his interpretation, it was that this individual mandate is so unconstitutional that it just, and because there's no severability to this, you can't separate it out, that it therefore nullifies the whole legislation. We'll see. I mean, again, I'm not a legal expert. This is all new to a lot of us. I think ultimately the Supreme Court's gonna have to figure all this out and make their ruling, and it's probably going to come up pretty soon, although I would imagine probably not before next year's election. But again, that leads us back to that debate theme. Next year's election, this is going to be the central focus. A lot of the past presidents and Congress and all that for the past 40-something years have really been putting this healthcare issue aside, and it kept on almost like a pressure cooker. The pressure keeps building and building and building and building, and today, it's exploded, and that's what we're left with. And between the enaction of the legislation and then the House's vote, really all it's done is just to polarize our country. I hope that answers that question. Looking at another question here. It has to do with some of the fines for employers. When do they come into effect? So 2014, that's when employers that have over 50 employees must provide health coverage or pay a penalty of $2,000 a year. Now, for those companies that have less than 50 employees, they're not going to have to provide coverage, as their employees can go into and buy their own coverage through their state's exchanges. So that penalty just applies to larger employees, those with over 50 employees. And that doesn't start till 2014. All right, well, on the screens you can see our phone numbers there, as well as my email address. I strongly encourage you to reach out to me. If you have any more questions, thoughts, or suggestions, I'd love to hear from you. And I thank all of you for your time in listening to us today, and I hope that you join us again on March 1st for the second half of this webinar. Thank you, and take care.